Excuse me, quiet please. My name is Maria Fernandez. I'll be your nursing assistant. Excuse me while I wash my hands. May I see your name band? Okay, Miss May, I'm going to help clean your dentures today. And let me collect the equipment. The equipment is a chuck. It's a nemesis basin. It's a toothpaste, toothbrush, and these are swabs. Think of it as a two-step situation. First, you're going to take care of the dentures. Now, in the real world, you have to follow infection control. You don't have to do it exactly this way, but the rationale behind doing this way has to be in whatever way you do it, keeping things clean and protected, and you're going to do it in two steps. First, you're going to take care of the dentures, and the second step, you're going to take care of the person's gums. A person that has dentures may have only one part of their, the lower part of their teeth that are false. So you're going to clean the lower part of the dentures, and you're going to swab the gums, or you can use a soft toothbrush to swab the gums. You're not going to put toothpaste when you clean the gums, but it's two parts. First, you're taking care of the dentures, and the second part is taking care of the person's gums, right? Or mouth care. Again, this is our mouthwash. We're converting this to being mouthwash.
Do you need privacy for this?
Yes. All skills except what skills need privacy?
Ambulation, feeding, weighing.
Ambulation, weighing, and feeding. Okay? So I have everything here. Bring everything over to the sink. Bring everything over to the sink. When you do it for the state board, you're going to be in a small testing area, one room. I'm going to lock the wheels. I'm going to raise the bed because when I'm giving mouth care, I'm supposed to be inspecting the person's mouth. Again, if somebody's very tall, you may just be able to do this. But if the person is short, you don't want to be bending down to look in. Okay? So I've locked the wheels, I raised the bed, I screen for privacy. I'm going to come over here, and everything gets brought over on the over-the-bed table. Nothing gets put on the sink. You have everything here that you need. I'm going to bring down a paper towel. One paper towel goes in the sink. Another paper towel goes in the emesis basin. For the state board, in the question part of the state board, they will say, what do you put in the sink? It's not a paper towel, it's a regular towel. It's a washcloth, something that has cushioning. Why do we, here we're just using a paper towel because we can, get rid of it quickly. Why do we line the sink with a paper towel or a towel? Yeah, so they don't break. Not that they won't go down the sink, that they won't break. If the dentures fall out of our hands, the person will be left without their prosthetic teeth, which will affect their eating, their communication, their self-esteem. All right? So we want to protect that. So paper towel in the sink. Where does the second paper towel go?
The chuck.
In the emesis basin. The reason it goes in the emesis basin is because sometimes these are made of metal. And if they're made of metal, this is where we're going to put the clean teeth. And if we put the teeth in here and it's made out of metal, what can happen? No, it can crack. If I put the enamel teeth in here, and this would be made of metal, it could chip the tooth. So we line the emesis basin for that reason. Okay? And here I leave a paper towel hanging, and I'm going to leave my water running throughout the procedure. The temperature of the water is what?
105.
No.
Tepid.
Cool water.
Oh.
Don't get into tepid. Tepid, maybe tepid hot for some people, tepid cool. So make it really cool water. If we wash the teeth or we rinse the teeth with hot water, it can deform the structure of the prosthetic. One of the students in a previous class did that for her mother. She thought, I'm going to use really hot water to clean them really well. And then the mother couldn't put them back in her mouth properly. So it does misshape the teeth. So you want to use cool water, Okay? So I have my water running in the sink. I'm going to take this opportunity to fill my cups, or halfway, with water. So you prepare everything. You're not going to use the cups till later when you give the person mouth care. Now I'm putting on my gloves. Excuse me?
Do all this before you put on your gloves.
Yeah, you just set it up. Or you can put on your gloves as long as you use a barrier to turn the faucet on and off. I just find it easier to put on my gloves later. It's harder to work with gloves. So now what I'm doing here, so you can see, is I'm taking the dentures out of the denture cup. I'm going to wet the toothbrush and put toothpaste on the toothbrush. I'm going to hold the dentures over the sink, and this is what I'm doing over the sink. I'm going gum line out, gum line out. I'm not holding it like this. Why not? It's easier to drop, right? So you want to hold them securely. You can still access the enamel, right? So you're brushing, and you're brushing. Don't spend a lot of time here in practice. There's nothing on these teeth, okay? And then you brush the surfaces. Then you brush the pink part. You're cleaning the whole tooth, but you want to get the food out, so you're going gum line down. Does that make sense?
Yes.
And then you clean that because that's going to sit on the person's gums. So after I do that, I rinse it. And there's only one, a partial. And I rinse the toothbrush. I'm going to put the clean teeth in the emesis basin. Now, I'm going to take the denture cup and I'm going to rinse. You would wash it, soap and water, whatever in the real world, but here for the state board you can just rinse it and rinse the top off. And you're going to fill the water so it covers the dentures. So I rinse the container and I refill it with water and I clean the top because the top has touched the dirty water. Yes, I'm going to put the dentures in here. Hi. Excuse me. No, it's a normal size. Okay? Okay, fine.
Okay, good, thanks.
So now the teeth are covered. I'm going to cover this. I'm going to take a barrier and put the dentures in a safe place, which will be, well, of course there's no fan in the hospital on top of the bedside stand, so you could put it on the bedside stand, or
That's just regular water you store the denture in?
just regular water for the state board. Okay, and I put it away.
Even
In the
if
real
it's
world,
in the
what
real,
would you
what
do?
would you store it in?
It depends. It could be in water. Some people use Polydent.
Yeah,
Not
that's
everybody
what I
uses that.
Okay.
Okay, for the state board, they want to see that you can handle. Hi, how are you?
Good.
A while back, yeah. All right. Yeah. Okay, so have a seat anywhere. Don't skateboard in the classroom. Thank you. Okay, so so you put the dentures away, and let's put that over on the side. Somebody could come up and trip on it. So either put it to the side. Thanks. So now I'm going to remove my gloves. Wait, bring down a paper towel. I'm going to shut the water. I'm going to pull the paper towel out of here. The emesis basin is clean. What did I put in the emesis basin before?
Paper towel.
I put a paper towel and then what did I put in it? The clean denture. So there's nothing. Now the person's going to have to use this to spit. So I want to get the paper towel out of here and the paper towel out of the sink. I remove my gloves. They're contaminated, right?
Yeah.
So I'm going to remove my gloves, wash my hands, put on fresh gloves.
Okay.
Second part, I bring this over. So you change your gloves. That's how many hand washings? It's
Already.
three.
Everything's clean.
1, 2, 3.
3.
No,
Yeah.
3, yeah. 3?
And you
3,
have
yeah.
more than one patient to do brushing in the morning.
Huh?
And you'll have more than one patient to do brushing in the morning.
Wait a second. When I came in, I washed my hands. After
the
I
second.
removed my gloves, I washed my hands. So this is 2 hand washing so far, okay? So now I'm taking care of the person's gums. You can either use the soft toothbrush, that's permitted, or you use swabs. These are toothettes. These you have to wet. Some come in a package and they're already moistened. So those you can just use, you don't have to wet those. They come with whatever, okay, on them. They have different things on them. So here I wet it. Sorry, Miss May. I'm going to clean the upper gum. I'm going to clean the lower gum, just across. And this is done on a volunteer, on your dummy. It's not going to be done on a real person. The third one is used for the tongue.
And it's just plain water, you say? Not
Plain water. No, for cleaning you just use water.
Okay.
You just clean it.
Oh,
No
Okay.
toothpaste.
Huh?
no paste.
No toothpaste.
Oh, okay.
Okay? So, or you can use the toothbrush. You're swabbing the top part of the gum. Now, if I were really cleaning somebody's upper gum and I had food there, what do you think I'd have to do? I'd have to rinse it out and then clean it and rinse it out and clean it. But for the state board, magically, you don't have those problems. So you're cleaning the upper, you're cleaning the lower, and you're cleaning the tongue.
How many times done?
Two strokes. And you're going to offer the person mouthwash or water. 2 rinses. They finish, you put this down, you dry the mouth, and you bring the towel away. You empty this. The toothettes, you can ask the examiner where they want them. You know, they can be reused again for just for the practice. These get, unfortunately, trashed. Someday they'll be recycled. I come over here, I empty this. I have to use my barrier to turn on the faucet, disinfect it, dry the outside, dry the inside, barrier if I have my gloves on. This is mouthwash, right? Put my equipment away. This goes into the trash. You notice we do generate a lot of garbage in healthcare. Remove my gloves. So this is hand washing 3. Wash my hands. Miss May, I hope you feel better. Here's your call bell. Would you like your head up or down? I lock my wheels. I lower the bed. I unscreen and I wash my hands. So it's 4 hand washings in this one. Okay? So think of it as 2 steps. We're going to be breaking up in the back. The first step is taking care of you've set up. You bring everything over to the sink. You line your paper towel in the sink. You put another paper towel in the emesis basin. You have the water running, cool water. You fill the cups up halfway. That's set. You lock your wheels, you sit the person up, whatever way you want to do that, however you want to fit that in. And then you take care of the dentures. You open up, you have your gloves on, you're going to brush the plate, or whatever it's called, the prosthetics. Rinse them, put them in the emesis basin, then rinse out the denture cup, top, fill it up with cool water, put the dentures back in there, put your dentures in a safe place, take the paper towel out of the emesis basin, out of the sink, remove your gloves, wash your hands, put on fresh gloves. Second part is taking care of the person's mouth. Just do it that way for the state board. Okay? Yes?
Yes.
Yes.
Beginning of every skill, you lock the bed. You
Yes.
always say lock the bed.
Right.
And at the end of the skill again, you lock
Yes,
the bed.
because
When do you unlock the bed?
Because in working on these beds, sometimes when you were leaning against the bed, sometimes the locks unlock as we're moving the bed. If
So
we're,
the bed should never left unlocked.
right, because if the person's getting up and it's unlocked, the bed moves away
Okay.
and it goes fast.
So
This is